Okay. And you brought up something very important, which is statistical relevance versus clinical significance, or statistical
Mhm.
significance versus clinical significance. What is the difference between the two? Because this is a very important topic in medicine that's not discussed too often.
Yeah, so if to say it like in a simple way, statistical significance is the significance you get in our statistical results. But clinical importance or difference is something you as a doctor would say, okay, that really matters. Or you as a patient would say, oh, I feel difference, I feel better. If we're measuring pain and you decrease your pain was 6 out of 10, and after my intervention your pain became 5.85, probably it wouldn't matter for the way you feel, right? Probably okay, it's still bad. It was bad, it's still bad. And the same as a doctor, you would say it doesn't really matter. And what happens sometimes in the research that we do find that statistically the difference is significant. So we do see difference between two groups, for example, or two measuring points, so before the drug and after. And it's consistent and it's significant. However, if it's the difference actually very small, the whole discussion can come: does it really matter for the clinical practice? Should we use this drug, or should we use this intervention, spend time on it when it's the patient doesn't feel difference?
And do we have a clear measuring, like a clear measure as to what clinical significance is besides the patient feeling better?
There's like a lot of discussion about it, and in medicine they also have some parameters when they say, okay, from this cutoff point it could be considered clinically significant. In placebo research, because we are still looking into mechanisms and we're still investigating how does it all works, we don't really look at clinical significance so much at
Okay.
this point, because it's such a it's not very new field, but it's still developing field, and we're trying to understand such complex mechanisms, so we are mostly interested in clinical in statistical significance. But then when I'm talking about this study with patients, I think it's important to just be honest and say, okay, we have some statistical differences, but I don't think the patients would really benefit from it.
Okay.
So it's too
Okay.
early to go to clinic and tell them you can use this procedure.
Okay.